We'll stop to share and begin again. There is it's a blue where I need to click.
Okay, just open your presentation like always, like you do on your computer.
Yeah, but it's not going inside. I don't know why.
Okay, just let me see.
Oh.
Okay, which one? These two doc files, yes?
Here, yeah.
Yes, the PowerPoint.
Congestive heart failure.
Okay, we can see it. Yeah.
Oh, but it's not, yeah. Yes. Okay. Okay. Can you see?
Yes, we can see.
Okay.
Yes, perfect.
Thank you. Good morning, good afternoon, or good evening to everyone. My name is Huang, Ling. I'm a medical doctor from Brazil. I'm very happy to be here in this cardiology conference. And I would like to thank the organizing committee to invite me to be here to share two studies. The first study I will present now is entitled Chakras Energy Deficiencies in Patients with Congestive Heart Failure. Let me see. Yeah. But before I will briefly describe Western medicine point of view, despite of advances in medicine management on heart failure, I will talk about this study following Hippocrates' quote that said that it's far more important to know what person has the disease than to know what disease the person has. Because nowadays, we are treating the disease, that the congestive heart failure. But if we treat the persons, this disease will be treated and you will see the result. Okay? Heart failure is a clinical syndrome caused by structural and functional defects in myocardial, resulting in impairment of ventricular filling or the ejection of blood. And the most common cause of heart failure is reduced left ventricular myocardial functions. However, this function of the pericardium, myocardium, and endocardium heart valves and great vessels alone or in combination is also associated with heart failure. And the clinical presentation of heart failure comprises symptoms of shortness of breath, dyspnea, orthopnea, on and paroxysmal nocturnal dyspnea, and also fatigue, weakness, lethargy, edema, abdominal distension, and right hypochondriac pain. Heart failure has primarily been recognized as a disease of the elderly population for more the people who has more than 60 years, and it is reported to be affected about 2 to 3% of the people in the United States. And to introduce some concepts of traditional Chinese medicine, I'd like to start to show the, let me see, the tree metaphor. Here is the different points of view between Western medicine and traditional Chinese medicine. This is a tree that I usually present in all my presentations. This tree symbolizes the human body, and this tree has a trunk with several branches. Each branch represents one medical specialty, and coming out of each branch, you can see many leaves. And the congestive heart failure is only a symptom or disease in a cardiology specialty, and Western medicine usually treats the heart. But the traditional Chinese medicine understands that all symptoms in all specialties is only a symptom. It's not the disease itself. What's the cause of the disease? It's on the root of this tree that's impaired in the majority of the patients that has symptoms in this tree. And also, TCM considers the influence of the external pathogenic factors that can influence the balance state of this tree. And that's why today we are not treating, I will show you what are the energy alterations in this root that is causing congestive heart failure. These are the main theory in traditional Chinese medicine, that they say that all the balance state on the health or the formation of the disease came from these energy imbalances between these four energies that are yin, yang, qi, and blood. Yin and yang are two forces that exist in all things in the world and all in the universe. And what the main of all treatments in TCM are to balance these yin and yang energies. And deficiency of this energy is very common in many diseases in Western diagnosis, such as in diabetes, a woman in menopause, obese patients, and patients with autoimmune disease, all are in this category of yin deficiency. And yang deficiency is very common in patients with, in such patients with obesity too, in patients with urinary incontinence, in recurrent abortion, and so many other diseases can have a yang deficiency. And to these two energies to flow inside the meridians, inside the vessels, there is the necessity of having qi and blood in adequately amount to flow inside the patient's body. Blood is produced by the spleen, that is the 5th chakra, and qi is when there is the yin and yang and blood in adequate amount, the qi will be in adequate amount too, and is distributed by the lung and the liver, or the 1st and 4th chakra. And this demonstration that when is an energy deficiencies in one or a combination of these deficiencies between these four energies, there is a formation of internal heat inside the vessel. And in these four energies, there are these energies in all our 5 massive organs in traditional Chinese medicine, such as in liver, heart, spleen, lung, and kidney. They have all these forces, and we need to do equilibrium between these forces to maintain health of the patients. The second theory that are in the root of that tree is the 5-element theory, that is the cornerstone of all treatments in TCM. These 5 elements corresponds to, to the water, wood, fire, earth, and metal. And they say that all the 5 elements they represent all things in our world also, including the human body. And the human body has, they are represented by the kidney, liver, heart, spleen, and lung, and different from the Western point of view. They are saying that all the internal organs are interconnected by the energy flow, because Western medicine understands that each organ works separately and they do not have any correlation between the internal massive organs. But in traditional Chinese medicine, when you have some imbalance in one of the organs, you will influence the functioning of the next organ. In this case, the heart, that is the the study today that we study today, it receives the influence of all the organs, because the other organs can influence the functioning of the heart. And when the other organs do have some impairment, or either the heart has some impairment in the energy point of view, he will not work appropriately and will have begin to have failure in their functions, leading to some cases to placement of pacemakers, or have some complications leading to myocardial infarctions that it will be my next presentation. Here is to show you the correspondence between the chakras and the 5 elements. This is a figure that I do in all my presentations, because as Hippocrates said, we need to search for ancient medical traditions prior to the knowledge we have nowadays. And the knowledge we have nowadays are only studying the leaf of the tree, only the materialized energy. And what we need to understand that our body has energy that we cannot see by the naked eye, because at the figure of the tree, you can see that the tree, the energies are under the tree that usually we cannot see, but they exist. And that is why we needed to understand that there is an energy flow inside our body, like our cell phones and all the computers they are functioning because of energy, and our body works with energy too. Without energy, we will not have condition to do this webinar now, and you cannot see me and only hear me too. And that is why if the human body do not have energy, he will not have condition to work and to maintain the health of the human. And when the patient has energy deficiencies in any of these chakra, or a combination or all these energy deficiencies, the patient will begin to have complications and begin to have so many diseases. In this case, congestive heart failure. And all these reasonings began in 2006 when I treated one patient that I will briefly tell you the history. It's a patient that was 70-year-old male patient. He was complaining leg pain, was treating using anti-inflammatory medications with no improvement. And he went to my clinic and we began to treat him with the Chinese tools, but his diagnosis on the root of that tree was kidney yang deficiency. He had deficiency in the second chakra, or in the kidney, and we began using some dietary counseling according to Chinese dietary counseling and systemic and auricular acupuncture. And what he said to me after 10 acupuncture sessions, he said that he went to his ophthalmologist, and ophthalmologist was very surprised because he was treating glaucoma for the last 40 years with no improvement. And the first time of his life, his intraocular pressure reduced from 40 to 17. And he was using eye drops for the last 40 years with any improvement of his intraocular pressure. And and after this case, because what I treated was he had the leg pain. It was in orthopedic, in a leaf here, but I treated him on the root. And if you treat the root, all the symptoms of the patient will improve at the same time, even you do not know that the patient has such symptoms. And that is why he had glaucoma in the ophthalmology specialty, but he didn't tell me that he had glaucoma. But When I treated the leg pain using the treatment in the root, I could treat his condition, all his conditions at the same time. And here's to show you that patients that has heart failure, I will show you one case report. They have deficiencies in the energies, deficiencies in the yin and yang, and deficiencies in all these forces that were causing the imbalances, and they have yang deficiency and qi deficiency. And I will show you one case report that I treated this year. Is a 82-year-old woman. She had Alzheimer's disease and have congestive heart failure since 8 years ago. And she was using medications to control the functions of the heart, using antihypertensive medications and antidepressant medications. And the family began to take her to the acupuncture sessions due to the pain in the upper limbs. Also, I tried another way of treatment of her depression and Alzheimer using replenishment of the chakras energy that I will show you. And she had also memory loss and apathy. And in the first appointment, what I noticed that she couldn't lie in the bed to do acupuncture because she was very she had some dyspnea, and all her hands were not the color of her fingers were showing that her respiratory and heart was not working properly. And I did her chakras energy measurement, and all her chakra were in the lowest level of energy, including the heart. But as I show you, the heart depends on the functions of the liver, and the liver depends on the function of the kidney, and the kidney depends on the function of the lung, and the lung depends on the spleen. And all these 5 organs were in the lowest level of energy. And what I did and that is why she was having Alzheimer, because Alzheimer in TCM, the memory and concentration are related to the kidney energy and not in the brain. The problem is not in the brain, but in the kidney, in traditional Chinese medicine. That is why when we treat Alzheimer and all the problems, if we treat the root, we will treat all the patient's disease at the same time. And that is why she had Alzheimer, and depression was because of her energy deficiencies, and is not, depression is only a diagnosis, but it's a wrong diagnosis because she was depressed because of energy deficiencies. And the first step is to change the dietary aspect. As Hippocrates said, make your food your medicine and your medicine your food. And you need to orientate the patient to take out all dairy products, cheese, yogurt, and all cakes and puddings and ice creams, all foods that has dairy products. You need to orientate to avoid and cold water and drinks and sweets and raw food, because all these foods can impair the production of blood here, because blood is produced by the 5th chakra, that is the spleen, and all these foods could induce the deficiency in energy of the spleen, leading to less production of blood. And this is the entrance of all the energy is in the spleen, the 5th chakra. And also the second group of the foods that I oriented to avoid was the ingestion of coconut, eggs, chocolate, fried food, milk, alcoholic beverages, and I forgot here, and also the coffee, soda, matcha tea, because these foods can induce the kidney energy deficiency, leading to less production of yin yang, and also this food can induce the imbalance of the liver. That's the first chakra. And I did the auricular acupuncture using apex ear bloodletting to take out some heat, because she had and when the patient has energy deficiency, it's very common to produce internal heat. And this is one of the procedures to take out, to balance the internal energies. Here is to show you the kidney, liver, spleen, heart point is here, the lung, and the other points to treat the emotions, the anxiety, and to regulate the sleep process, because during the sleep, the patient will replenish the energy of the kidney. And here's the medication that I use to treat this, to replenish these chakras energy, because in China, they usually use Chinese herbs, but in Brazil, I had some problems to have these herbs. And I decided in 2015 to begin a homeopathy course. And during my homeopathy course, I wrote another theory using homeopathy, linking to traditional Chinese medicine. And nowadays in Brazil, I can treat all my patients that has these chakras energy deficiencies using a very easy medication to find, and also cheaper than Chinese herbal medicine. And this kind of medications, homeopathy, is the medication of choice to use in all kinds of treatments today, because in my research that I did in Brazil, the majority of patients in my clinic has this pattern of deficiencies of energy caused by the influence of the electromagnetic radiations that is leading to this pattern. And this is not only in congestive heart failure, but all of our patients, beginning in the baby and the children, adolescents, young adults, and all patients. The majority of the patient, more than 90% of my patients has this pattern. And if you do not treat this condition, this is characterized as they are all immune compromised, because energy means immune system. And here's to show you that the patient had this color in the beginning of the treatment. And after this beginning of this treatment, she was very happier. And the hands and all her symptoms improved, and she would walk and smile and have a more normal life without having complications of the heart. And you can see that the heart improved their functions, and the patient is very well today, and the family is very thankful for the kinds of treatment that we did. As she went to treat her pain in the lower limbs, but as we treated the root, all her problems, including Alzheimer, including heart failure, including depression, and also the pain improved at the same time. This is another study that they presented last week, only to show you that patients with memory loss also have chakras energy deficiencies, the same reasoning that I use to treat these patients. This is to show you that heart failure in Western medicine is only treated in the heart, but in traditional Chinese medicine, we search for the root problem of this tree. Here's to show you why we need to use more high diluted medication instead of high concentrated medication, because according to Arnold Schultz law, created in 1888 by two German researchers. They demonstrate that the use of high concentrated medication can induce a toxic effect inside the patient's body, leading to a less energy inside the organs, or can be lethal and can be cause death to the patients. That's why nowadays, as I show in my research in Brazil, all my patients do not have energy. And that's why I think we are in this pandemic, because I think the whole world can have this pattern of deficiencies of energy leading to immune deficiencies. And that is why we need to choose high diluted medication to treat all conditions, all kinds of the disease, to improve our energy and improve our immune system. And here's to show you that acupuncture and homeopathy in Brazil are both considered medical specialties. In 1980, homeopathy in 1995 of acupuncture. And they are both specialties that are treating the patient on the energy point of view and not in the deeper level, and not just the symptoms. Here's to show you that to treat patients with congestive heart failure, you need to have the two kinds of medicine in mind, in Western, but in traditional Chinese medicine that understand the root, the energy point of view in the origin of all kinds of the disease, to you to understand in the deeper way how begin the congestive heart failure in our patients. And according to Hippocrates, it's important to consider ancient medical traditions prior to the knowledge we have nowadays. Thank you for your attention. If you have any question, I will be very happy to answer it. Thank you.